Hi everybody, Dr. David Ross here. I want to tell you some important practical issues about NeuroGage and NeuroQuant and what you need to do to assess your patients with traumatic brain injury or other brain disorders. And I'm going to especially focus on traumatic brain injury. So you'll want to get NeuroQuant brain volume analyses and NeuroGage brain volume analyses both. Of course, depending on the clinical situation, but I'm basically talking about the kind of patients I work with, which are patients with suffering from chronic effects of mild to moderate traumatic brain injury. And then the question is, where does your patient have to go to get these types of analyses? Well, first of all, the patient can go to their local MRI center to get the MRI brain scan. And then there seems to be a confusion of this. Some people think they have to come here to Richmond, Virginia to get NeuroQuant or NeuroGage. That's not true at all. The vast majority of MRI centers in the country can do neuroquantable MRI scans, but they do have to be educated if they've never done them before. They have to be instructed on how to set up their MRI scanner. You have to set it up exactly right, but as long as they set it up right, and we can tell them how to do that, and they can go to the NeuroQuant website to check all the information on how to set it up. And if they set it up right, then they can do it. So the patient goes to a local MRI center, and then the brain images are produced, and those are sent to us here in Virginia. We then do the NeuroQuant analyses, and we take the MRI brain volume data generated by the NeuroQuant analyses to do our NeuroGage analyses, where we do the additional analyses not done by NeuroQuant, including checking for abnormal asymmetry of the brain and checking for brain volume change over time. And so you can see with this dotted line here, there are two locations. Your patient does everything locally, and then we do everything else here in Central Virginia. So it makes it very convenient and easy to do. The other practical question is when to get the first MRI scan. My joke on that is to get it the day before the injury. But of course, we really don't know when the injury is going to be, so you want to get the first MRI, neuroquantable MRI, as soon as possible after the injury. And I mean literally, if I could get it the same day or the next day, I would. We've never been able to do that in the many years I've been working on this. Just get it as soon as you can. Probably the quickest we've gotten one is maybe a month or 2 months. And we're trying to get that, and we have been getting it closer to the time of injury, but we still have a ways to go. If you are able to get it in a month or less, or especially a couple of weeks or less, then you may be in a situation of brain swelling, which is a different ballgame when it comes to measuring brain volume. Probably after about a month or so, and we don't know the exact cutoff on that, and that may depend on the severity of the brain injury. But somewhere around a month, the swelling will have gone down and the brain will start shrinking if the effects were severe enough. Everything else I say will be assuming that the first MRI was done at least a month after the injury. What you do next is, if your first MRI was obtained less than a year after the injury, get your second one about 2 months later. The reason for that is that brain volume is shrinking at a very rapid rate during the first 2 or 3 or 4 months. And during months 6 through 12 after the injury, it starts plateauing. It's not shrinking as fast. And you want to catch it on the steep part of the curve. You have a better chance of detecting an abnormal rate of shrinking and finding out the truth about what happened to the patient's brain. So if your first MRI is done within a year of the injury, get the second one 2 months later. However, if your first MRI is done more than a year after the injury, then you can get your second MRI a year after the first MRI. Why is it different? Because after about a year, the atrophy curve is plateaued and the brain is shrinking on average in our data about 2% per year from year 1 to 2 and 2 to 3. And so at that point, you don't have to rush to catch the steep part of the curve because it's already flattened out. That's the rate of change curve. Also, by giving it more time, you have more time for the volume to shrink. And so with your cross-sectional analyses, you're going to have a better chance of seeing differences. All that gets fairly technical. The bottom line is just to remember that if your first MRI is done within the first year of injury, get your second one 2 months later. If your first MRI is done more than a year after the injury, get your second MRI 1 year later. Hope this is helpful.